Hi, I'm Brandon Todd of Medicare Gurus, and today we're going to talk about the parts of Medicare. And I want you to get ready because this is real simple, and put on your ears because we're going to hear it. All right, you're on Medicare. Here's the parts of Medicare. You have A, B, C, and D. A and B go together as traditional Medicare, C is Medicare Advantage, and D is prescription drugs. Okay, so if you have A and B, you can't have C. If you have C, you can't have A and B. But you can't have you can have A without B, but most people don't, and A and B normally go together. Now, if you have D, C could come in two forms, as MAPD or MA. If you have MA, you can get a Part D, you can get a Medicare Part D, but if you have MAPD, then the Part D is in already the plan, so you can't get a Part D. So A, B, C, and D, that's it. I hope you know everything, and God bless. Is that a terrible video or what? Look, Medicare is confusing, we all know it. And a lot of times that's what people will talk to you about. They'll just go real fast. These are the things, but I'm going to go a little bit slower for you. So what are the parts of Medicare? Let's go through Part A. Part A is hospital insurance. It covers all your inpatient care in the hospital, skilled nursing, hospice care, and home health care. Part A goes along with Part B, which is known together as traditional Medicare. Back in 1966, when they started Medicare, they only had A and B. It wasn't until much later, after 2000, where Part C came along, and then at the same time, Part D. So, traditional Medicare is A, which covers the easy way to understand this. You can get all in this. It covers anything done inpatient, and that's a good rule of thumb. And Part B covers anything done outpatient. That's when you go to the doctor. That's anything done outpatient. Even if you go to the hospital for day surgery and come back home, then that's considered outpatient. So remember, traditional Medicare, what's always been there is A and B. A is inpatient, B is outpatient. And now if you have A and B, then you don't have traditional drug coverage, which is a Medicare Part D plan, which we'll get to in a minute, but you are eligible to cover those co-payments and deductibles with a Medicare supplement plan. We'll have other videos on that where you can go into depth to how to choose the right Medicare supplement plan. But virtually, if you choose the right plan, you can go to any doctor with traditional Medicare and Medicare supplement. For your doctor and hospital bills, you can go to any doctor, any hospital, anywhere in the country that Medicare that accepts Medicare, and you won't have to pay a penny, except for normally a small little deductible the first year, if you get the right plan. And sometimes the F plan even covers that. So that's a really good way to have peace of mind, knowing you're 100% covered on doctor and hospital visits without restrictions, is traditional Medicare, A and B, with the right Medicare supplement plan. Call Medicare Gurus anytime at 844-MY-GURUS, and one of our advisors will help you out with that. So the next part is Part D. So Medicare Part D is prescription drug coverage. Now, when I started in the insurance business in 1997, we didn't have prescription drug coverage. And if you're on Medicare, there was nothing. But around, I believe it was around 2005, some legislation was passed, and they came out with the increases to the Medicare Advantage program, and the Medicare Part D prescription drug coverage was formed. Now, I can get into a lot of things like that. Medicare Part D is very, very complex, but what you need to know is that it covers drug coverage. And go to different videos, different teachings we'll have on how to choose the right Medicare Part D coverage, but what you need to know is A and B are traditional Medicare, and D is prescription drug coverage. If you have A and B, you can get a D. So Medicare Advantage, also known as Part C. Now, Medicare Advantage is a Medicare replacement plan, or a traditional Medicare replacement plan. That's the easiest way to think about it. I don't know if that's the legally perfect description, but when you get on a Medicare Advantage plan, you actually give up the Medicare Part A and B traditional Medicare, and you elect to be on Medicare Part C. And Medicare Part C, Medicare Advantage, is where the Medicare program now gives to the private insurance companies a monthly stipend for everyone who comes onto their plan in order for them to take care of your health coverage. What that means to you is that you'll have a lot of companies that you know by name that have private health insurance plans. So you'll get to choose one of those. Medicare pays them. They're your actual insurance coverage, and the Medicare program and the government oversees that, but they're not the one that actually pays the claim. Now within Medicare Part C, you can get what's called an MAPD, or you can get a Medicare Advantage plan. MAPD is Medicare Advantage with Part D, so it would include Part D, and some have some extra benefits. Or you can just get a traditional Medicare Advantage that doesn't have a PD included in the same plan, and then you can shop your prescription coverage through all the Part D plans. So you can have it in one plan or two plans. Which is best for you? Who knows? You have to look at your particular situation, and that's why you need to get a Medicare guru at 844-MY-GURUS. So that's the parts. In summary, you have Medicare Part A and B, and if you're new to Medicare, you choose between A and B, or a D, or a C, and if you have one, you can't have the other. So if you have a C, you can get one with a Part D included or without it, and if you don't have it, you can get another Part D plan. And if you have A and B traditionally, then to cover your drugs, you'll get a Medicare Part D plan. I hope that makes it a little simpler for you. We have a lot more videos that will explain the nuance of each one, and always go to the tools on our site to find the best rates for you in your particular area and to help you walk through the steps of choosing the right plan for you on Medicare. I'm Brandon Todd with Medicare Gurus. Make it a great day. God bless.